let us begin with our today's video. Now, before starting our today's video, I would like to ask a question to you all watching this video. Do you eat outside food on stalls, in hotels or anywhere else? Do you enjoy eating street food with your friends and family members? If yes, then this video is for you. Today, we are going to learn about a disease which can attack you very easily if you enjoy all these activities. The name of the disease is typhoid. In our today's video, we are going to have a look at typhoid's signs, symptoms and homeopathic management. Now let us have a look at what is typhoid. Typhoid is a strong bacterial infection caused by the Salmonella typhi bacteria. The incubation period of this bacteria is about 10 to 14 days. That is, a person starts getting symptoms after 10 to 14 days of the bacterial entry. Typhoid is a water and a foodborne communicable disease. Typhoid spreads through contaminated food and water. Signs and symptoms of typhoid include a prolonged fever, which is usually a low-grade fever and which rises slowly and remains constant and high at the end of second week. This fever is preceded by prodromal symptoms like headache, weakness, muscle ache, sweating, and the most important one is the stomach pain. At the end of first week of the infection, the patient might also develop a rose-colored maculopapular rash on the chest, which is a diagnostic of typhoid infection. Other systemic symptoms like loss of appetite and weight loss, etc. are also seen. The disease can be diagnosed by a Vidal test and also by isolation of the bacteria from the blood. Now that we have had a look at the clinical features of typhoid, we will now have a look at the management part of the disease. The management part of the disease is divided into homeopathic management and the auxiliary mode of management. That is, the measures that a patient should take apart from taking medicines while suffering from this infection. The patient should remain hydrated, have an adequate rest and also take a good balanced diet and keep it as liquid as possible to reduce the stress on the digestive system. Homeopathy has many medicines which can work very well in typhoid fevers like eucalyptus, arsenic, CARBO, muriatic acid, ARNICA, RHUS and BAPTISIA. Eucalyptus. Eucalyptus is a very good remedy when it comes to treating typhoid. The key indication for prescribing this remedy is offensive and foul smell of all the discharges. Eucalyptus is known as a strong disinfectant and a powerful antiseptic in our homeopathic literature. Next two very important drugs while treating typhoid fevers are arsenic and CARBO. The common indication which indicates both these remedies is extreme weakness and prostration. Arsenic, apart from the weakness, is also a very good remedy for watery foul stools along with hectic fever and great thirst. Arnica and RHUS are two important drugs when it comes to treating typhoid. Arnica and RHUS both share a common clinical indication while prescribing these remedies. Both Arnica and RHUS have severe body pain. The body pain in Arnica is a sore, bruise type of a pain, and in RHUS is moreover a drawing pain. The Arnica patient has thirst only during the chills and fears of being touched. Last but not the least, BAPTISIA is yet another important remedy for treating typhoid. It is considered to be the king of all the anti-typhoid medicines. BAPTISIA can cure typhoid in all its stages. BAPTISIA can be prescribed when the discharges of the patient are highly offensive and are foul smelling. The temperature of the patient is usually between 103 degrees Fahrenheit to 106 degrees Fahrenheit, and also the patient has a delirium, that is, body parts are scattered and he has to gather them at once. Thus, this drug is also very useful in prevention against typhoid when given in low potencies.